Hello, I'm Dr. Edward Pearson, a hematologist in Dallas, Texas. I specialize in bone marrow and blood disorders with a focus on leukemia, lymphoma, myeloma, and the myeloproliferative neoplasms. BESREMi is a monopegylated interferon for the treatment of polycythemia vera. It's in the NCCN guidelines for the treatment of polycythemia vera for both low-risk symptomatic and high-risk patients, and can be used for initial cytoreduction in these patients. In addition to treating the patient's symptoms and keeping the numbers under control, we also want to target the bone marrow. The bone marrow is the actual site of disease where the mutated hematopoietic stem cells live.
Indication: BESREMi is indicated for the treatment of adults with polycythemia vera. Important safety information. Warning: risk of serious disorders. Interferon alpha products may cause or aggravate fatal or life-threatening neuropsychiatric, autoimmune, ischemic, and infectious disorders. Patients should be monitored closely with periodic clinical and laboratory evaluations. Therapy should be withdrawn in patients with persistently severe or worsening signs or symptoms of these conditions. In many, but not all cases, these disorders resolve after stopping therapy.
In the PEG-and-VERA trial, patients were treated with BESREMi for over 7.5 years, with 80% of those patients achieving a complete hematologic response. That means the patients kept their hematocrit under 45% in the absence of phlebotomy, a leukocyte count under 10, and a platelet count under 400. 61% of patients achieved comprehensive disease control, as well as the additional requirements of normal spleen size and an absence of thromboembolic events. The median time to achieve that comprehensive disease control was 7.8 months. BESREMi is a biologic agent that works differently than other agents for the treatment of polycythemia vera. It's the only monopegylated interferon that has its actions within the bone marrow. Because BESREMi is expected to activate the immune system, the side effect profile seen with it, including flu-like illness, myalgia, arthralgia, and fatigue, makes sense given the mechanism of action. In the PEG-and-VERA trial, nearly 40% of BESREMi-related adverse events occurred in the first 3 months of treatment, with many resolving after the first 3 months of the 7.5-year study. The most common reported adverse reactions defined as treatment-emergent adverse events throughout the 7.5-year treatment period were influenza-like illness, arthralgia, fatigue, and pruritus. When starting BESREMi, it's very important to educate patients on the steps that we take to avoid or prevent and treat any adverse events that do occur. I've had numerous patients who have suffered from fatigue and low-grade flu-like illness. Regarding the fatigue, I think it's important to really focus on sleep hygiene, avoid drinking caffeine after noon, avoid looking at bright lights or especially blue lights later in the evening when you're supposed to be trying to fall asleep. Patients need to listen to their body and alternate periods of rest and activity so that they have adequate time to recuperate. Have them inject the medication at a time that is convenient for their life. Many of my patients will choose to administer BESREMi on Friday afternoon so that they have the weekend to recover. You can also use acetaminophen to manage some of the other symptoms such as pyrexia, myalgia, and arthralgia. Patients who are suffering from itching may benefit from taking cooler showers, avoiding hot water. They also need to use the skin products meant for sensitive skin that do not have fragrance or other harsh chemicals in them. The first-generation antihistamines can help with the itching that they are having while they're trying to fall asleep. For patients who have injection site reactions, applying an ice pack after the injection may help with some of that inflammation. It's also important that patients rotate areas so they are not injecting into the same area over and over again. For patients with sore throat from interferon use, they might benefit from hot tea, especially with honey, the use of lozenges, or gargling salt water. BESREMi works by stimulating the immune system. As a result, it can have a different side effect profile in every patient as it starts to work. If patients want to quit BESREMi after taking 1 or 2 doses, I think it's really important to take on that role of the coach or the cheerleader and really focus their attention on their goals of treatment. There are various resources that we can use when discussing with a patient. The company's website is quite good. I will oftentimes open that up on the computer when I'm in the room with the patient to facilitate our discussion, as well as giving them materials that they can take home and read at their leisure. When patients are getting started on BESREMi, there's a demonstration kit, a brochure on what to expect, among other resources for the patient's education. Polycythemia vera is a long-term problem, and it needs a long-term solution. Focusing on the things that we can do to improve their symptoms and reminding the patients that these symptoms do tend to get better over time can help them stay on the medication so that they can get the full benefit of the drug.
Indication: BESREMi is indicated for the treatment of adults with polycythemia vera. Important safety information. Warning: risk of serious disorders. Interferon alpha products may cause or aggravate fatal or life-threatening neuropsychiatric, autoimmune, ischemic, and infectious disorders. Patients should be monitored closely with periodic clinical and laboratory evaluations. Therapy should be withdrawn in patients with persistently severe or worsening signs or symptoms of these conditions. In many, but not all cases, these disorders resolve after stopping therapy. Contraindications: existence of or history of severe depression, suicidal ideation, or suicide attempt. Hypersensitivity to interferons or any inactive ingredients. Moderate or severe hepatic impairment. History or presence of active serious or untreated autoimmune disease. History of transplantation and receiving immunosuppressant agents. Warnings and precautions. Depression and suicide. Closely monitor patients for any symptoms of psychiatric disorders and, if needed, consider psychiatric consultation and treatment or dosage modifications as listed in the full prescribing information. Endocrine toxicity. Do not use BESREMi in patients with active serious or untreated endocrine disorders associated with autoimmune disease. Evaluate thyroid function in patients who develop symptoms suggestive of thyroid disease during BESREMi therapy. Discontinue BESREMi in patients who develop endocrine disorders that cannot be adequately managed during treatment with BESREMi. Cardiovascular toxicity. Patients with a history of cardiovascular disorders should be closely monitored for cardiovascular toxicity during BESREMi therapy. Avoid use of BESREMi in patients with severe or unstable cardiovascular disease or recent stroke or myocardial infarction. Decrease peripheral blood counts. Monitor complete blood counts at baseline, during titration, and every 3 to 6 months during the maintenance phase. Pancreatitis/colitis/pulmonary toxicity. Interrupt BESREMi treatment in patients with possible pancreatitis, colitis, or pulmonary toxicity and evaluate promptly. Consider discontinuation of BESREMi in patients with confirmed pancreatitis or who show signs or symptoms of serious ulcerative or hemorrhagic colitis, or who develop pulmonary infiltrates or pulmonary function impairment. Ophthalmologic toxicity. Advise patients to have eye examinations before and during treatment. Discontinue BESREMi in patients who develop new or worsening eye disorders. Hyperlipidemia/hepatotoxicity/renal toxicity. Monitor serum triglycerides, liver enzymes, hepatic function, and serum creatinine at baseline and during therapy. Avoid use of BESREMi in patients with eGFR less than 30 milliliters per minute. Discontinue BESREMi in patients with persistently marked elevated triglycerides, evidence of hepatic decompensation, or if renal impairment develops during treatment. Dental and periodontal toxicity. Patients should have good oral hygiene and regular dental examinations. Dermatologic toxicity. Consider discontinuation of BESREMi if clinically significant dermatologic toxicity occurs. Driving and operating machinery. BESREMi may impact the ability to drive and use machinery. Patients should not drive or use heavy machinery until they know how BESREMi affects their abilities. Patients who experience dizziness, somnolence, or hallucination during BESREMi therapy should avoid driving or using machinery. Embryo-fetal toxicity. Based on the mechanism of action, BESREMi can cause fetal harm when administered to a pregnant woman. Obtain a pregnancy test in females of reproductive potential prior to initiating treatment with BESREMi. Advise females of reproductive potential to use an effective method of contraception during treatment with BESREMi and for at least 8 weeks after the final dose. Advise women not to breastfeed during treatment and for 8 weeks after the final dose. Adverse reactions. The most common adverse reactions reported in greater than 40% of patients were influenza-like illness, arthralgia, fatigue, pruritus, nasopharyngitis, and musculoskeletal pain. Drug interactions. Patients on BESREMi who are receiving concomitant drugs, which are CYP450 substrates with a narrow therapeutic index, should be monitored to inform the need for dosage modification. Avoid use with myelosuppressive agents, narcotics, hypnotics, or sedatives, and monitor patients receiving the combination for effects of excessive CNS toxicity. To report suspected adverse reactions, contact Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including boxed warning.